Should you become a hospitalist or should you subspecialize? This is a question that is a tale as old as time, and in this video, I'm going to be going over all of my reasons for why I want to go into general internal medicine. I'm going to talk about the pros and cons of specializing versus staying general, and hopefully this video can help you in making your decision as well. So first off, a quick explanation on what is general internal medicine versus subspecializing. So for general internal medicine, this is basically when you do 3 years of a medicine residency, and then afterwards you graduate, you can either go into hospital medicine or you can go into primary care, which is more outpatient focused, and then you're a full-fledged attending. If you wanted to subspecialize into fields such as cardiology, gastroenterology, rheumatology, pulmonology, and things like that, then you would have to do an additional 3 years of fellowship, additional training to become a certified subspecialist. I think in the past, it was a lot more popular to subspecialize, and even now, there is a big pressure, especially when you go to an academic institution, to move towards subspecialty fields, especially with how complex patients are. Everything is becoming further and further specialized. But I think there are a lot of merits to staying general internal medicine, whether that's hospital medicine or primary care, and let me tell you why. Number one for me, and I think this is the most important reason, is that honestly, I just want to start working earlier and I want to get my life started. I think with a lot of medicine and medical training, a lot of it is kind of delayed gratification. We have a very long educational process, and it can be really difficult to continue wanting to do training after we've already, reached our 30s and we're still going through additional training. To be honest, I feel like at this point I'm already ready to be a full-fledged doctor, and there is this sense that you're kind of almost delaying your life a little bit more, and that's obviously not entirely true because while you're doing fellowship, you're obviously still living life and doing things, but you're kind of trading a lot of free time in order to do an additional specialty. The main thing you have to ask yourself is how much more are you willing to push off, kind of getting to that final stage of your life where you're just kind of a full-fledged doctor and doing what you're going to be doing for the rest of your life. When you go into fellowship, you are going to be going into a 2 or 3 year thing that is actually tougher than residency, and you're going to be continuing to work like 70, 80-hour weeks every week. This is something that I've totally seen, watching the fellows work at my institution. It's just like, wow, I already feel like residency is a hard process, and now I'm watching these fellows, and it doesn't seem like it gets any easier. If anything, it seems like it gets harder once you're a fellow. The other huge thing is that when you go into a fellowship, you have to go through the entire match process again, which means that you have absolutely no control over what location you might end up with. Sure, you can make a really strong CV and really optimize your chances to staying in a particular location, but this is another thing that, I'm not really willing to give up. So if I wanted to go into pulmonology or gastroenterology, would I be willing to go back to the East Coast where I don't have any family, or, Midwest where I have literally no connections at all? I think this is something that plays a big role for me because, wherever I would match for fellowship, my wife would also have to give up her job and move to that location, and I'm going to be separated from family potentially for another 3 years, not able to establish my friend group. One of the things with medicine is we're moving around all the time, and you have to establish all these different friend groups all the time, and there's a point where you're kind of like, man, I just kind of want to settle down, establish like my friend group, and not have to like deal with switching around all the time. Finally, if you do choose to subspecialize, that means you are really continuing the rat race during residency, and you have to continue to be boosting your CV, doing research, making good connections and networking a lot while you're in residency, which is another thing that is just kind of an additional stressor on top of what you're already doing in residency. Oh yeah, one more thing about subspecializing is that one of the draws of subspecializing is that they're often compensated higher, significantly higher. But one of the things to consider is that there is absolutely no guarantee that the reimbursement rates are going to be the same in the future and that they're still going to be making that amount of money in the future. So in my opinion, going into a specialty because they're compensated better is a little bit of a risky proposition because you really should be going into it because you love it and you really enjoy it. If you're just thinking about the money, you have no guarantees that 10 years from now, colonoscopies are still going to be making so much money for you every time you're doing one. And before I go any further, I don't want to downplay anybody who wants to do a fellowship because I think there are a lot of really good positive things and pros to doing a fellowship. My mom is a specialist, for example. She's a cardiologist. And I think there are a lot of lifestyle benefits. Obviously, the compensation is a lot better. And there's a lot of smart reasons for why you would want to do a fellowship, especially if you're passionate about something. But for me, my biggest passion is lying in with teaching. And I think for me, general internal medicine is really where you're going to get the biggest bang for your buck in terms of doing teaching, working with medical students and residents. Whereas with subspecialists, you are really only going to be teaching kind of at the fellow level at that point. So you're really limiting the scope of the people that you can teach. And I don't know if you can tell from my YouTube channel, but I am very interested in all of medicine. And so one of the big benefits of staying in general internal medicine is that you continue to use all of that knowledge. There is a sense with some specialties that you begin to only focus kind of on like your one organ of expertise, and you kind of lose some of that knowledge that you used to have about the entire rest of the body. For me, I didn't feel like that was something that I could accept because I really genuinely enjoyed learning everything that we did in medical school, and I would feel really bad if I had to give up all of that knowledge that I worked so hard to obtain. And then point number 4 is that, I think when a lot of people think about what a doctor does, general internal medicine, either a primary care doctor or hospitalist, is kind of what like the majority of the lay population imagines when they're talking about or when they're thinking about what a doctor does. So if you look at like Dr. House, for example, like popular TV show, or Scrubs, a lot of these different shows is really kind of the idea of what a doctor does is what general internal medicine is. And that's something that I, kind of envisioned myself doing when I went into medical school and when I was planning to do internal medicine. And so I think it's cool that I'm going to be fulfilling kind of that vision that I had. The next point is I honestly think that as a generalist, you probably have one of the bigger impacts of how a patient is actually going to do. Whether you're a hospital doctor, you're managing all of the different conditions that they have, you probably have the biggest impact on that patient's outcome. And so I feel like that's probably the most rewarding part of it. And if you're a primary care doctor, you are actually, the most useful person in the entire medical system because you are the person who is preventing them from developing all of these crazy severe conditions. And in that sense, you really are making the biggest possible impact on your patient's life and on the medical system as a whole. And the last point I wanted to make is that I actually feel like the lifestyle of being a hospitalist is pretty good. Generally, people work a 7 on, 7 off schedule. So you work 7 days in a row, and then you have the entire next week off. So pretty much you only work about 26 weeks of the year or half of the year, and you get so much free time to do whatever you want when you're on the off periods, okay? One big thing to consider is, do you really want to spend 3 more years of 80-hour work weeks where you're being worked to the bone, basically, when you could be a hospitalist and you could be 7 on, 7 off. You could be vacationing, you could be working on your YouTube video guides, you could be spending time with family, working on your old hobbies, you could be starting a family. Like, the biggest thing is the best years of our life are when we're young, right? And the further you delay things, the less you're going to be able to enjoy, when we're kind of at our peak. We've already given up most of our early 20s and mid 20s, and 30s, we're still in good health. That's the perfect time to vacation and really make the most of our time. So honestly, I think getting a head start on that by 3 years is such a huge deal. This is a point that I'm going to have to figure out, down the line, because there is a high rate of burnout among hospitalists, and it's not like a lifestyle specialty like psychiatry or anesthesia where hours are just super good in general. And a lot of times when you are in the hospital, you are really go and doing a ton of work. But I think depending on where you go and what your schedule is, you really have the potential to have a crazy amazing schedule. You could be traveling the world every other week if you wanted to. All right, so what about some of the cons of doing general internal medicine? I think one of the big things that people they don't really talk about, but I think people feel inside, is that there is an associated lack of prestige with going into general internal medicine rather than a specialty. People have so much respect for their cardiologists and their gastroenterologists and their subspecialists, all things like that, because they're all, further experts in their field. But to be honest, I feel like this is a little flawed because we have already gone through so much training and we have already done a lot of education and we are already quite expert in our field already. And really, does prestige even matter at this point, right? Like, you had to weigh certain things at different stages of your life and realize, at this stage, do I want to focus on prestige? Does that really make an impact on my life? Or does getting to work earlier, staying in the same location, being near family, spending more time with family, are those things that are more important to me? So for me, I don't feel like prestige really matters as much. I think it's kind of sucky that this is kind of the perspective that people who subspecialize are automatically more prestigious and the people who are generalists are like not as prestigious. But to be honest, it doesn't really matter to me. And I really don't think it should matter for the majority of people either. The other downside of being a hospitalist is it can be hard work, especially depending on where you end up working. A lot of times you're going to have to be doing non-medical stuff, which is honestly the worst part of the job because we all signed up for this to do medicine. And a lot of times we have to do a lot of like social work related stuff or just non-medical things, billing, insurance things. It's kind of a headache, and generalists really have to deal with the brunt of it. Another con of general internal medicine is that you have to know a lot about a lot of different conditions, and you have to be okay with not being an expert in all of these conditions and not knowing everything all the time. When you're an expert, one of the advantages is you're kind of really focused, and I feel like they probably feel a lot more in their comfort zone a majority of the time they're treating patients. Also, when they're going to see a patient, they don't have to deal with all the social work issues. They don't have to deal with all the side like medical issues that are really annoying to deal with. They just have to focus on their one thing. And like I said in a previous video, the human brain is only designed to like hold a few things at once, in its working memory. So subspecialists treating patients is a lot easier, I think, in terms of cognitive load than people who are generalists. But to be honest, I think that opens up the opportunity for generalists to even play a bigger role in the patient's care, because I feel like in some senses, a generalist has to be smarter than a specialist because you have to work a lot harder to know the entire breadth of conditions that your patients could be coming in with. And so for me, that's something that's very motivating, that I want to become the best generalist that I can. And so I'm going to have to work even harder to make sure I know enough about all the different conditions that are possible. So looking on Reddit, you can see this is a very, very common topic. Oh, I didn't even realize a tale as old as time. That came into my head, but I didn't realize it's probably because I read this and so it was stuck in my subconscious. But debating hospitalist versus fellowship, a tale as old as time. PGY1 here was gung-ho on pursuing cards and hemonked. While I'm not in love with hospital medicine and find it tolerable, I am less enthused about not only playing the rat race of getting into fellowship, but also doing more years of training. This person said, I went in planning on specializing, tired of research and using up my free limited time to further my resume, and overall, I have been quite happy with general medicine. I plan to do hospital medicine at least initially. The pay is quite reasonable, about 200 10-hour shifts a year. Eventually, I could see myself doing outpatient or finding a more rural place that allows a mix of both. I enjoy medicine, but I enjoy my personal life as well, and I can't imagine spending more years being underpaid, working fellow-like hours for a job I may like only marginally more. Sure, I could make more in cardiology or GI, but I don't think it's worth putting off having a family or buying a house or enjoying my hobbies. Here's the truth. IM doctors are doing what most people imagine doctors to do each day. We speak to and examine patients, work through diagnostic dilemmas, consult with other physicians, counsel patients and their families, and literally use everything we learned in medical school. These are all points that I kind of talked about. And this last point is something that honestly really speaks to me a lot. So if that speaks to you, I think this really should be a sign that maybe general internal medicine is right for you. On any given day, I see interesting pathologies, discover interesting pathologic findings on my physical exam, read my own EKGs, read my own chest x-rays, review CTs and MRIs myself, speak with specialists. Occasionally, I will perform procedures. The fact is this: IM is the single most interesting specialty. You like diagnostics? We do diagnostics. You like managing certain disease states? We practically see them all. A majority of diagnoses made in the hospital are made by emergency medicine, followed closely by internal medicine. This person, I think, shines a very, very good light on internal medicine that I don't think is entirely accurate because, like I said, there are some downsides to doing general internal medicine. And then they kind of crap on some of the specialists a little bit. They were calling like the consultants trained monkeys. This guy says, when I call cardiology, 90% of the time, I am telling them to cath the patient. 90% of the time I call nephrology, I'm asking for dialysis or renal biopsy. They agree with my assessment and do as I ask. If you like to do hobbies over working, do hospitalist or outpatient. It's great. You get your hand in medicine, but also have time and money to fill your free time with your own interests. All right, here's one that got downvoted. Do yourself a favor and do not be a hospitalist. Become an expert in something. As a soon-to-be hospitalist, I find this logic very flawed. First, if you graduated med school, then you are an expert in something. To suggest that you have to specialize to be an expert in something is insulting to PCPs, hospitalists, etc. Secondly, the healthcare system would not work if everyone was highly specialized. Most specialists I've worked with want to focus on their areas of expertise, rightly so, and may not be as interested in organs they don't own. Unfortunately, patients and diseases don't really work that way. Someone has to know a little bit about everything. And so that totally sums up why I think being a generalist is super valuable, but also one of the most interesting things that you can do. So general internal medicine is really a field that I think a lot of people will enjoy. I think it's very underrated because of this history of everybody wanting to specialize, and everything in medicine is moving towards more subspecialty training. But honestly, there are so many benefits of being a generalist, and I think you should really honestly highly consider it in terms of your own career and your own lifestyle and your own choices about what you want for your future. I think there are a lot of benefits to doing it. And honestly, I'm really interested to hear what your guys' thoughts are. I think there are definitely advantages to both sides, and both are reasonable picks. But for me, these are the reasons that I wanted to do general internal medicine. And hopefully that helped you in making your decision. Let me know in the comments what you think about this subject, and I'd love to hear what your stories are. And like and subscribe if you enjoy this content and want to see more. And thanks for watching. I'll see you in the next one. Peace.